Welcome. Professor Tricia Butler here. Just going to talk a little bit about some easy ways to help you understand blood pressure. Okay. So I'm going to give you two different analogies. Okay. We're going to start with thinking about the Amazon River. All right. So when we are thinking of a river, okay. So during the rainy season in the Amazon, so this is our river. You can see we would have, our river would be fast flowing. It'd be to the banks here, okay? That fast flowing river is similar to a patient that is hypertensive, okay? So a patient that has hypertension, okay? So when a patient has hypertension, so there's a couple different things that we can do to potentially drop their blood pressure, okay? And I think the Amazon River analogy is an excellent one. So if I want to, I've got this fast flowing river and it's all the way to its riverbanks. So if I were to try to slow down the rate of my river, how could I potentially do that? Okay? One way that I can do that is I can take and create some type of divergence and have some of the water go out this way, right? Lessening the amount of water that's actually in my river. This diversion here in humans, when a patient has hypertension, one of the ways that we can lessen their blood pressure is to divert water off or give them a diuretic. Make them pee it out, right? So that's one of the ways that when a patient is hypertensive that we can decrease their blood pressure, okay? All right, diuretics is an excellent one. Another way that we can also, for a patient that is experiencing hypertension, we can take these riverbanks and we can potentially move them farther out. So if all of a sudden my riverbank is here, guess what? It's not going to be going as fast. So another way that we can decrease a patient that has hypertension is we can give them a vasodilator. Okay? Okay? So two of the ways that with patients that have hypertension is we can either divert water, thinking of that Amazon River, divert water off of that patient using a diuretic, or potentially we can move, in essence, their riverbank farther out, which would be equivalent to a vasodilator. So both diuretics and vasodilators will drop blood pressure. Okay. Now let's talk about hypotension. Okay. So hypo. All right. So in this case, still looking at our Amazon River analogy. Okay. So now I don't have a whole lot of water in my Amazon River, right? It's the dry season. Okay, there's still water in there, but not to the point that we are comfortable with. So in the case, that is indicative of a patient that is experiencing hypotension, right? So in that case, so how, if I wanted my river to go just a little bit faster, what is one of the ways, or what are one of the ways that I can potentially increase the amount of flow of my lazy river? Well, we just talked about a vasodilator, so in this case, we can potentially move the riverbanks as well. If we move the riverbanks out, we've already said that would make the blood pressure go down. We don't want to do that. So in this case, we can potentially bring the riverbanks a little bit closer, concentrating that water. So one of the ways that we can increase a patient with hypotension is we can give them a vasoconstrictor. So that is one of the other ways that we can also, again, hypertension. Well, let's go back and say we still have our normal riverbank here. We don't have a whole lot of water here. Well, another way, if I'm not going to move the banks of the river, another way that potentially that I can get my river to run a little bit faster is I can do a rain dance, right? We can add fluids. So if I add fluids to my patient, or to my river in this case, add fluids to our patient, that will also increase their blood pressure. think this is one of the easiest ways to truly understand blood pressure in a human being, with the river analogy and the fact of when it is fast flowing, ways that we can, which would be indicative of hypertension. One of the ways fast flowing is we can either divert water through a diuretic or change the river banks, or in our case, the size of the blood vessels for our patients, a vasodilator. Both of these will decrease your patient's blood pressure. Again, on the flip side, when we have hypotension, we have a slow moving river. One of the ways that we can do it is we can either add fluids to our river, or in this case, to our patients through, say, a bolus, or we can give a vasoconstrictor medication that in our river analogy would be bringing the river banks in our analogy of our patients would be constricting those blood vessels to, again, increase their blood pressure. I hope that this video helped just a little bit with understanding hyper and hypotension.